host Right on Four Corners every Wednesday, 10:30 to 11, when I'll talk to local and regional authors. So please join me Wednesdays here on 90.9 FM KSJE Farmington.
KSJE is supported by San Juan Regional Medical Center, a community-owned and operated hospital. Here for you when you need us. From emergency care to routine checkups and screenings, caregivers are here and ready to provide the safe, high-quality care you need close to home. Online at sanjuanregional.com with the latest health information and resources to help you live life better here. Good morning, everybody. I'm Scott Michlin. Megan Cullip is away this week, but thank you for joining me for our COVID-19 Community Information Program here from KSJE. It is Friday morning, and we have a lot to cover this morning with some great guests, and so I want to tell you who is going to be on the program with me this morning. We'll be speaking with Suzanne Smith. She is the Chief Nursing Officer at San Juan Regional Medical Center. Dr. Brad Greenberg will be joining us, of course, emergency medicine technician at San Juan Regional Medical Center, a recent and regular guest on the program. And Matt Bieber will be phoning in as well this morning. He is the spokesperson from the New Mexico Department of Health in Santa Fe to give us an update on the statewide situation. But of course, the news has been all local of the last 24 hours. We had a major press conference yesterday with members of the hospital, held by the hospital, but also including representatives from the three cities in San Juan County. Farmington Mayor Nate Duckett was on the call. Also, the Mayor Pro Tem of Aztec, Rosalind Fry, the City Manager of Bloomfield, George Duncan, and they were all on the call talking about how COVID has impacted their communities. And the reason that we're hearing so much about it is because of the case numbers, and they continue to go up. We're going to share a couple of things with you from the State Department of Health dashboard. The first thing, of course, is the weekly COVID cases. Now, this is as of October 25th. As you can see, the trend is down, but since then our numbers have been up, and not just up, but way up. And so that is the reason for all the concerns that we are hearing about from the community these last 24 hours. And so as we take a look, again, coming from KSJE.com, we update the COVID numbers on a regular basis. Just yesterday in San Juan County, the State Department of Health reported 287 new COVID-19 cases in San Juan County, and just an additional death as well on Thursday. That added to the total across the state of 1,611 cases and 16 deaths in New Mexico. But San Juan County, unfortunately, is at the very top end of the case numbers being reported, and that compares us with the much more heavily populated counties, counties like Bernalillo, of course, with Albuquerque, Santa Fe County, Doña Ana County with Las Cruces. San Juan County, unfortunately, has some of the highest rates of COVID cases in our state. From the Navajo Nation, again, yesterday they reported a total of 37,154, but an additional 103 cases reported yesterday and 5 additional deaths across the Navajo Nation. That was the numbers from Thursday over there. And so you can see why local officials are raising concern about the cases here. Going back to the New Mexico Department of Health dashboard, if you remember that, we showed you that when we were doing the color-coded system of the counties during some of the COVID-19 coverage, of course, and every county is in red these days. And if you could see the San Juan County, the latest update there, up through the 1st of November, our cases per 100,000 residents is at 104.5. And that is another reason for concern. The positivity rate here in San Juan County is now 18.05%, and that is another reason for concern. If you recall, and I had to look this up myself, but back when we were talking about, remember the red and yellow and green and turquoise levels on that map, the idea was to have no greater than 10 cases per 100,000 people. And we wanted to have a positivity rate of less than 7.5%. And so as you can see, San Juan County now is at 104.5 per 100,000 with a test positivity rate of 18.05%. And so that is another reason why folks are just so very, very concerned this morning. San Juan Regional Medical Center, the other big story this week, of course, is enacting their crisis standards of care. And we've talked about that in the past, but we'll mention that again with our guests who'll be calling in just a moment and being live on the program here because of what that means and what that means for managing patient levels at the hospital. So let me turn to our guests who are on the phone this morning, who are joining me live, and we appreciate them calling in from San Juan Regional Medical Center. Good morning, Suzanne Smith and Dr. Greenberg. I'm hoping you both are on the line this morning. I think you are. Good to have you with us. Dr. Greenberg.
Good morning, Scott.
Good morning. And Suzanne Smith, good morning. Nope, we've lost Suzanne Smith, but let's get her back. There she is. Suzanne Smith, good morning to you.
Good morning. Sorry, I apologize for disconnecting.
That's okay. I bet it was me and not you, but I appreciate it. Technology, we love it some days. So great to have you both with us. You were both on the call yesterday, the press conference, that the hospital hosted with other community members, and so I wanted to touch base on that just a moment. Dr. Greenberg, let me start with you because 2 weeks ago we talked on this very program about the crisis standards of care and that you had the option to enact that from the governor and from the state, and here we are this week, and now that is the case at San Juan Regional, correct?
Yes, Scott, that's absolutely true. Since we last spoke, things have continued in our community and at the hospital to really demonstrate a substantial impact to our community. We currently have 87 COVID-19 or persons under investigation in the hospital. Still looks like 9 folks holding in the emergency department. And it's been really just a remarkable surge in the last couple weeks. Our local percent positivity has markedly increased. The state measures are at about 18%, and our measures for 14 days are 21.75%. That is a really high number. Our 7-day average is 23.8%, another really high number. And so we have a really significant, I would say, you could call it an epidemic superimposed on the COVID-19 pandemic. And despite the fact that you may hear that things are getting better across the country, the Mountain West, New Mexico, Colorado, and some other states in our region are markedly getting worse. And so we indeed had to begin using crisis standards of care, and we were very fortunate also to get some degree of external assistance from the New Mexico Department of Health as well as the federal government through the National Disaster Medical System. And so we are, this is an all-hands-on-deck moment for us. And I hope that those folks in our community that are listening can take this to heart and really think about how they could make good decisions to reduce the possible impact to the hospital.
Right. Thank you, Dr. Greenberg. And Suzanne Smith, let me ask you the question about staffing then at the hospital, because, of course, Dr. Greenberg talking about the numbers of COVID patients or COVID suspected patients at the hospital. Of course, we know that the hospital is still open for other healthcare needs and is trying to manage those as well. And so, as Dr. Greenberg said, you're getting additional assistance from outside sources to maybe help with some staffing and things along that line. Can you talk a bit about that for us?
Yes, I can. So we are having some staffing challenges and stuff. The significant increase in the number of patients that we are seeing in all environments. So in the emergency department and those requiring admission do then put a strain on the number of staff that we have available to provide that care. So we are very pleased to be benefiting from the state-supported staff. So there's going to be registered nurses and respiratory therapists who will be joining our team to help care for and manage patients in those inpatient environments and in the emergency department. We do still have, procedural areas are open. Our operating room, of course, is still functioning, and we, are responsive to emergencies in all environments, whether it's regarding the cath lab or the operating room or the endoscopy lab. So we have to, we do provide fully staff those areas and stuff for those emergencies, challenging emergencies that people experience, not just in our communities, but in some surrounding communities. San Juan Regional Medical Center is a regional referral area, and so we provide services that other smaller facilities in our region don't provide, and those are life-saving activities that we need to provide for members of our community. So we're pleased to have some additional assistance. I will guarantee you that.
Right, sure. Well, good to know. And of course, it might give your other employees a bit of a break too, who I imagine are working long shifts and long days. Is that still the situation? I imagine that is still the case.
It is still the case, and the regular shifts plus working extra shifts and stuff to provide that care, really to respond to the demands for patients, and really having an extra set of hands is always, it's a welcome relief for the increased volume that we're experiencing.
Sure. Very good. Thank you very much, Dr. Greenberg. Let me come back to you. In the press conference yesterday, the common theme that I got was that folks should really consider becoming vaccinated if they haven't already. And you and I have been talking about that for a long time on this program, but that seemed to be the common theme, that there are still folks in our community that, for whatever reason, have chosen not to become vaccinated. And it seemed like your advice was to make healthy choices and to talk with your physician, your personal care, primary care physician, and get the information you need to make that choice for not only yourself but your family.
Scott, that's absolutely correct. And I would really implore folks to get vaccinated. Just this week, the CDC endorsed the FDA decision, and now we have vaccinations available for children ages 5 to 11. So now anyone ages 5 or up is eligible for the Pfizer vaccination. The Moderna vaccination and the Johnson & Johnson vaccination also are still out there, and they're broadly available in the community. And I'll tell you that the best thing that you can do for your health, for the health of your neighbors, your friends, your family, the best thing that you can do to help contribute to help reducing the burden to your hospital and your healthcare infrastructure is to get vaccinated. I think it's never too late to get vaccinated. Of course, it's better if you got vaccinated before, but please, depoliticize the vaccine. This is about science. This is about public health. This vaccine has been well studied, probably one of the best, if not the best, and most thoroughly studied medication in the history of medicine. So this is something that everyone should do in our community and in any community, but ours especially, because we have such a high burden of illness right now and such a high impact to our hospital. Please get vaccinated. Thank you.
Thank you, Dr. Greenberg. And again, just to confirm, and I may sound like a broken record continuing to ask you this question, but you mentioned the number of COVID positive inpatients at the hospital or patients suspected of having COVID, and I just want to confirm, because it always seems to me that the vast majority of those patients who have to be hospitalized with COVID-19 are unvaccinated. Is that still the case?
That's absolutely true, Scott. And it really does seem I believe that when we did the data analysis, and I think it was detailed somewhat in the press conference yesterday, but I believe that it's approximately 81% of all hospital admissions are in the unvaccinated. And I also believe that I think it was 88% of the intensive care unit admissions were unvaccinated. And I think it was 94% of all the deaths were in the unvaccinated. And so, this is, by and large, when it comes to healthcare infrastructure and the impact to the hospital, to the community, this is a pandemic of the unvaccinated. If we were all to be vaccinated, then that would significantly reduce the burdens to the hospital and to healthcare workers. So again, I just implore everyone, if you are not vaccinated, please get vaccinated. If you know someone that isn't vaccinated, please help them find a trusted resource where they can get good science-based education about the vaccine and make good decisions.
Thank you. Thank you very much. And Suzanne Smith, let me come back to you and ask you a bit about the other care going on at the hospital, because, again, I know we've been reminding, you all have been reminding folks not to put off health physicals and screenings and all those things that a lot of folks seem to have done during the pandemic, and now they're showing up maybe sicker than they maybe normally would because some of those screenings that may have caught something early weren't done, and so now something has progressed and they're showing up maybe sicker than they normally would at the hospital. Is that what you're seeing here in Farmington?
We are seeing that here in Farmington, really, I think nationally, maybe even worldwide, seeing cases of patients who have deferred care, particularly screenings, whose disease may have advanced unexpectedly, and they're not aware of it. And so really we encourage people, if you to maintain your routines for seeking health care, for maintenance, for the screenings as they are due, so that we can assure that people are identified. If they have an illness, it's identified early, and care is ongoing. We have not stopped those elements of care. They continue, and people need to feel confident and comfortable that they can safely come to the hospital and not be at risk of something. They need to come when they need the care. The emergency department is 24/7, and if people have an emergent health issue, they need to seek that care.
Good point. Thank you very much. Dr. Greenberg, let me come back to you again and ask about this crisis standards of care. And I know it is just an option that is given to the hospitals to manage these high numbers. And I believe it was mentioned yesterday again at the press conference that one of the other issues maybe that you have is where in the past you could maybe transfer some patients to other facilities that had some room, with all hospitals becoming more and more full with COVID patients. That option may not always be available. Is that some of the reality that you are facing at San Regional these days?
Great question, Scott. Unfortunately, that is absolutely true. We are having very, I would say, sustained and ongoing challenges in our attempts to transfer patients to other facilities. Mm-hmm. Other facilities in our region, like I mentioned before, are having similar challenges. It's not just us here. It's all of New Mexico, also Colorado. We know that Utah and Arizona are similarly having some increasing challenges with the COVID surge. This is our Delta surge. Delta surged, other places in the country, in Florida and Georgia, et cetera, California earlier, but this is ours. And we know that those areas had some substantial challenges. During the surge that Texas experienced earlier this year, they were transferring patients to all over New Mexico, including attempts to transfer to us. So they had challenges transferring out. We're having challenges transferring out. And what that means is that we have to do our best here to meet the needs of our local community and our region. And that does involve utilizing some elements of crisis standards of care, but more importantly, it involves us really deploying all of our preparedness efforts, being very creative and thoughtful and efficient with the healthcare resources that we're applying, and really making sure that we're doing the greatest good for the greatest number, and we're doing the very best with what we have at hand.
Thank you very much. And just to wrap up with both of you this morning, and I can't thank you both enough for your time today to share this important information with our audiences, but I know folks are tired of COVID. I think you folks and your colleagues at the hospital are probably more tired than the rest of us of dealing with this, and but unfortunately here we are, and we're still dealing with it, and a new surge coming, and colder weather coming, and winter coming, and folks staying indoors, and that's a concern for health officials too, because of course we know this virus can spread more easily inside than out. And so again, besides the vaccines, which I know both of you endorse and promote for folks to consider getting, and now for children ages 5 to 11. The other things that we've known that we should be doing, the mask wearing, the hand washing, the distancing, all those things are still valid ways to try to keep this thing in check, are they not? Dr. Greenberg?
Scott, those COVID safe practices, hand washing, social distancing, wearing a mask, those are absolutely effective. I mean, they're one of those things that they're so simple and people get frustrated doing them over time, and we absolutely empathize with folks that are having challenges sustaining the discipline necessary. But I got to tell you, it is necessary now. It's not just necessary, broadly, but necessary for us in our community. Necessary to keep yourself, your friends, and your family safe. So please get vaccinated. At this time, please wear a mask. At this time, please engage in COVID-safe practices. And I'd like to add one other thing. At this time, please understand that healthcare workers in our community have been working so hard for so long, and they deserve, each and every one of them, no matter what they do and how they're working to care for others, deserves your, I would say, your appreciation and also your admiration for how long they've worked and how hard they've worked. So offer them your support, because they're going to be there for you when you're sick.
Good point. Dr. Greenberg, thank you very much. Suzanne Smith, your thoughts too, please, as we wrap up today.
I think really just emphasizing Dr. Greenberg's commentary, those safe practices that we have each become a little weary of and maybe a little lax on are really so important. And as colder weather, we merge fall into winter and we gather for the holidays, to really just be cognizant of those of who you're around, and really ensuring that you have safe practices to keep yourselves and the ones you love safe and free of this disease. So very important. And also, again, I agree with Dr. Greenberg in acknowledging the staff at San Juan Medical Center. Every staff member, no matter their role, has really risen to the occasion and is caring for large numbers of patients and increased workload in every care environment. And they are doing so. They come back every day. And it's been hard. And yet here they are, because they are loyal and they know the value of the work that they do to provide quality care for patients. Thank you, Scott.
Thank you, Suzanne Smith. We're so grateful for all of them and you both for the service that you both provide to the community. So thank you both very much for joining me this morning.
Thank you for asking.
Thank you, Scott.
You bet. Thank you both very much. It's Dr. Brad Greenberg and Suzanne Smith from San Juan Regional Medical Center, my guests this morning here on KSJE, our COVID-19 Community Information Program. And again, we are seeing these higher numbers throughout our community, and that is the reason why the message this morning is just so urgent and so serious about how the community will be dealing with this latest increase in COVID cases. I mentioned this press conference yesterday that was held and hosted by San Juan Regional Medical Center, and they invited some of the officials from the three cities, Farmington, Aztec, and Bloomfield. And I did want to play some comments from George Duncan, just briefly, because the community of Bloomfield has been hit hard with an employee who died from COVID-19. So let me get his comments queued up for us to listen to this morning. George Duncan, the city manager of Bloomfield.
I'm the city manager with the city of Bloomfield. We have and continue to provide information to our employees to properly social distance, wear a mask, and practice good hygiene procedures. I have been vaccinated, and I urge our employees to do so. And I also urge all of the public to get good information and make smart choices in regard to the vaccine. The city of Bloomfield lost one employee to COVID. It devastated our small community. Tragically, this was an impetus for many of our other employees to vaccinate. We believe we have around a 65% vaccination rate within the city. I would also urge, I have a background, in fire and EMS, and I urge our citizens to make smart choices and reduce risk. Do things that will limit your exposure to injury and help our healthcare workers. I would also say don't delay any healthcare issue you may have, but just make smart choices.
It's George Duncan, the city manager with the city of Bloomfield, this morning with us on KSJE. Joining us this morning to talk a bit more about the state's situation in regards to COVID-19 and the newly approved boosters for younger New Mexicans. Matt Bieber is on the phone from the New Mexico Department of Health. Matt, again, thanks for joining us and welcome back to KSJE.
Absolutely, Scott. Good to talk to you.
Yes, thanks for being here. And so let's start by talking about this latest approval of vaccines for younger kids, just approved this week, as a matter of fact. And so does this mean the state apparatus is start going to roll those out pretty quickly?
Absolutely, yep. People can already go on to vaccinenm.org and schedule their children for vaccine. In fact, we have a really simple way of doing so at vaccinenm.org/kids. So folks that are already registered in the system can link their kids' profile to their own profile and schedule their kids, and folks are already doing that. In fact, before this was even possible, before scheduling was even possible, we had about 20,000 parents pre-scheduled or pre-register their kids just so they could be ready when the moment arrived, and that moment has now arrived.
Got you. I know there's been a lot of talk about how to keep the doses separate because it's a different size of dose for the younger kids than it is for maybe the teens and the adults, and so all that labeling is already being done as it comes from the manufacturer. Is that how it works?
Yeah, you got it. There are a lot of different ways that the manufacturers and the providers can distinguish between the doses, different colored caps, and obviously the kid doses for 5 to 11s, it's a much smaller dose. It's a third the size of the adult dose. So yeah, we're confident our providers are going to be able to keep all that straight logistically. They've been preparing.
Got you. Very good. And of course, these will be available at all of the places where the adult doses were available, right? There'll be special clinics set up, but I know, pharmacies around the state are being good partners with you in getting the vaccines out to the population. And so all those locations will be able to provide the vaccine for kids ages 5 to 11 as well?
Yeah, I mean, I can't say that absolutely every provider will be exactly the same. We've had some providers come and go over the course of this pandemic, understandably. But yeah, in fact, I shouldn't say we will. We do have hundreds of providers up and running around the state, and they're integrating the child vaccines into their regular operations. So it should be pretty seamless. Obviously, we're always on the lookout for any hiccups in the process and look to address those quickly. But the majority of the providers remain registered through vaccinenm.org. So for folks and more than half of the state's residents are also registered through vaccinenm.org. So for all those folks, that process will continue as it always has, and then the providers that are working outside the system will continue doing their own scheduling and appointments as they have in the past.
Very good. And Matt, I know the website makes it pretty easy and easy to do, but I know in the past there was like an 800 number for folks to call if they had trouble or if they didn't have access to the internet or needed some extra assistance to register. Is that still available for registering kids as well these days?
It is, yes. So we're really encouraging folks to only call if you don't have access to the internet. If you don't have the internet at all, or you're not able to use the internet for some reason, then please do call 1-855-600-3453. Again, 855-600-3453. We've got a lot of call center folks there ready to answer calls, but given the level of interest, we want to make sure that their lines are open and ready to receive folks who truly need the help. So if you can use the internet, we've done everything we can to make that site as easy to use as possible, so please do.
Got it. And I know libraries and schools and chapter houses across the state are offering Wi-Fi and internet services, so it should be fairly available for folks who maybe don't have it at their homes, but always a good option to be able to use the phone number as well. Let me ask you a bit about boosters, because that's the other conversation that folks are having around the country is, booster shots being approved now for more folks. And so those are rolling out in New Mexico, the idea being for older adults, for folks who have maybe high-risk jobs, things along that line, 6 months after your last COVID-19 vaccine. That's kind of the rules for boosters these days?
You got most of it, yeah. There's
okay.
A couple of other folks that are eligible. So if you've got Pfizer and Moderna and you're 65 and older, or you live in a long-term care setting, or you have a medical condition, an underlying medical condition, or you work in a high-risk setting. And we've got all the details available at vaccinenm.org/boosters. If you're in any of those categories and it's been 6 months or more since your second dose, yes, you're eligible for a booster. If you got Johnson & Johnson, anybody 18 and older who received their first shot more than 2 months ago is eligible. So we know this is a little confusing, so we've laid it all out on the website, vaccinenm.org/boosters. We even have a little quiz on that site that just, you answer a couple of quick questions and it tells you if you're eligible for a booster at this time. And then the final thing to add there is that the FDA and the CDC have approved mixing and matching for boosters. So if you got Pfizer and Moderna the first time, but you want to get Johnson & Johnson for your booster or vice versa, you can do that. And again, all that's laid out in detail on the website.
Right, thank you. And that's important. And I guess it sounds, maybe to some people, are a bit confused about that advice about being able to mix and match, but it sounds like from the studies that have been done, the effectiveness is as strong when you do that, and so that's why the choice is being given for folks if maybe they had a bad reaction the first time around, or what do you think the reasoning is behind the mixing and matching?
I think what the CDC is trying to do there, and I want to be clear that this is the CDC's view on this matter. I think from what I can tell and from what we can see, what we have enough data to know that it's effective, that you will get additional immunity protection by adding any of the boosters to your initial primary series, but we don't yet have enough data to say absolutely which combinations are most effective. And so they're just saying, we know enough to say it's safe and effective to use any of them. We just can't tell you absolutely which combination will work best for in every individual case. And I think this is one of those moments where, the public has shown a lot of grace and trust in appreciating the fact that the science is still developing and we're sharing the information we have. And when that gets updated, when we know more, we will update with more.
Understood. And I guess the other thing that we do know for a fact, right, Matt Bieber, from all the studies, is that the effectiveness does increase for any vaccine that you received originally once you do get a booster over time.
You got it. Yeah, because these vaccines work the same as absolutely every other vaccine that we all take, which is to say that over time, immunity protection does wane. It does decrease a little over time. And so what the boosters are doing are just really kind of topping you up, so to speak. It's bringing your immunity protection back up to a high or a higher level. And that's a good thing, especially as we head into, we're calling it sixth season. We're in the midst of sixth season now. I don't like the name, but we haven't come up with anything better just yet. But, with flu season and winter coming on, it's especially important for folks to have as much protection as they can against COVID-19. And not only for themselves and their families and their community members and their elders, but also because of the situation with our healthcare system here in New Mexico. As many folks will know through your coverage and other folks' coverage, our hospitals are under enormous strain, and they have been for a very long time. And when I say that, that's really not exaggeration at all. It's not that they're at 85 or 90% of capacity. It's that they're 110, 130, 140% of capacity, which means they're making choices that no healthcare provider wants to make. They're doubling up beds in rooms where really only one person should be. They're putting patients with serious conditions and serious interventions like in the hallway because there's no other space. These are not conditions where you want to go to the hospital, especially because there might not be a bed when you arrive, and there might not be a person to take care of you when you get there. And that's a situation that we can all help fix if we just make sure that we're protected and we don't need to go to the hospital. We can ensure that the hospitals are available for the folks who absolutely need to be there, and for folks who can protect themselves and not end up there in the first place. It's a very good thing for all of us.
Right, very true. And I do want to make the point, I think it's important to remind folks that the vast, vast majority of folks who are hospitalized with COVID-19 at our hospitals are those who have not been vaccinated. And that is true all across the state, is it not?
Absolutely true. Yeah, it's something we hear about from our healthcare professionals, our nurses, our emergency room personnel all the time. Is that they're showing up at work, they're placing themselves at risk, and they're caring for folks who are extremely sick, who don't need to be there at all, because as you say, most of these cases are folks who haven't gotten vaccinated yet. So for themselves, for their families, and also for the sake of our healthcare workers, we're encouraging everybody to get vaccinated as quickly as they can. And And if they still have questions about the vaccines, we're very, very happy to answer them in whatever format or forum is most helpful. And we've got lots of different ways to interact with folks, and happy to receive those questions. The other thing I'll add to this topic, and I appreciate you spending some time on it, is that at this point, most of the folks in the hospital are not there because of COVID. The ones who are there because of COVID are mostly unvaccinated, as you say. But most of the folks in the hospital are there because they delayed care. Because they delayed care during the pandemic, they didn't see the doctors, they didn't check in on routine matters, and now they're showing up much sicker and need to be in the hospital for much longer to get more elevated levels of care, which is another reason our hospitals are under strain. So, if you're in that bucket and you haven't gotten a regular visit, haven't gotten a checkup over the last year and a half, now's the time to do it. By all means, please reach out to your healthcare provider and schedule that visit so that you're up to date on your healthcare.
Good advice. And Matt Bieber, we heard from our local folks just earlier this morning about that very issue here at San Juan Regional Medical Center, and that is the advice that's coming out from them as well. And just one final thought about the vaccines, and we've always said here, it's an individual choice. We get that. We understand that. If someone has a question about whether or not they should get a vaccine, maybe they have some underlying health conditions or things like that, the person to talk to, if it's not someone at your department, the Mexico Department of Health, is their own primary care physician. That's the person that can really help guide them in making this decision. But again, the facts and the studies have shown that you are less likely to get very sick and maybe need to be hospitalized if you are vaccinated. That will keep you out of the hospital and keep you healthier than if you are unvaccinated and contract the COVID-19 virus.
You made two really important points there, and I'd like to underscore them. The first is, yes, absolutely. Please, if you have any questions, your first source ought to probably be your primary care physician, somebody you trust, somebody that's taken care of your health for a long time, somebody whose office you can go to and ask all the questions you need to in privacy with discretion. But that other point is really key as well, which is to say that, we hear some feedback about the fact that there are breakthrough cases, and we knew that would happen. Of course, every vaccine has breakthrough cases because no vaccine is perfect. So unless a vaccine is 100% effective in every case, there will be breakthroughs. There's no question about that. But as you say, the difference is that the folks who've gotten vaccinated, they might catch COVID, but they typically don't get very sick. The folks who are going to the hospital, the reason our hospitals are full of folks who are unvaccinated is because the vaccines protect you from getting very sick. You might catch the COVID, you might even have some mild symptoms, but you're far less likely to go to the hospital, and you're far less likely to die, as in many, many, many times less likely. So we really encourage you. I mean, I can't tell you the number of times. It's really every day. We see a story, often here in New Mexico, of somebody who, thought it wasn't a serious matter, thought it didn't really need to attend to it, and then they got COVID, and they're in the ICU, and they're dying, and they don't get to even interact with their family members in some cases, and they feel like such regret. And the whole thing is so tragic because it's so avoidable. And none of us really have to be in that situation, or very few of us. So, again, that's just a plea for folks to look after their own health and those of their family members and get vaccinated when they can.
Very good point. Well, Matt Bieber, I always appreciate your time speaking with us and giving us the perspective from the state level. Thank you for the work that you are doing and your colleagues, and we appreciate your time. We'll talk to you again in maybe a couple of weeks.
Sounds good, Scott. Same to you. Appreciate the time. Talk to you soon.
All right. Thanks very much. Matt Bieber from the New Mexico Department of Health joining me this morning here on KSJE. And as we mentioned, there are going to be vaccine clinics available for the COVID-19 vaccine for younger folks now, offering the vaccine for folks 5 to 11 years old, coming up next week here in San Juan County. So we want to pass that information along with you. Monday, a vaccine clinic at the San Juan County Public Health Office. Tuesday's clinic will be offering the vaccine to the younger ages 5 to 11 at the San Juan County Public Health Office from 2:30 to 5:30 p.m. Wednesday is another clinic scheduled at the San Juan County Public Health Office on South Miller in Farmington from 9 a.m. to 10:30, and then again on Wednesday, November 10th, from 3:30 p.m. to 4:30 p.m. And again, all this information we share on our Facebook page, and of course, it's all available at the New Mexico Department of Health page and other sources online as well. But we're happy to share that with you, of course, this morning during our COVID-19 Community Information Program from KSJE. And just to wrap up this morning, to again remind about testing. Testing continues, of course, throughout the community as well. Aztec schools every Wednesday and Friday from 7 a.m. to 3 p.m. at Fred Cook Stadium, offering free COVID-19 testing. You can register in advance at curative.com. McGee Park, of course, that site's been open for a very long time, and of course they are open Monday through Friday, 8 to 3 p.m. at McGee Park. And again, you can register ahead of time at curative.com. Farmington Municipal Schools District Office also doing testing on Mondays, Tuesdays, and Thursdays on 30th Street, 3401 East 30th Street in Farmington. That is our program this morning, everybody. We thank you very much for joining us, and if you felt this information was useful and helpful, we would invite you to share it on your social media networks so that it gets to a broader audience. We feel local information is so very important, and so nothing against Albuquerque, but we're a different community, so sometimes how we react to something and can deal with things is a little bit different than how our friends and neighbors do it in other parts of the state. So we thank our guests who are on the program with me this morning. Again, Suzanne Smith and Dr. Barrett Greenberg from San Juan Regional Medical Center, Matt Bieber from the New Mexico Department of Health. Megan and I will be back next Friday with another Solutions from the Street program, another COVID update in 2 weeks on Friday here on KSJE. Stay well and stay safe. I'm Scott Michlin. Talk to you again soon. KSJE is supported by the Farmington Civic Center, bringing a full slate of entertainment to Farmington and San Juan County. Charles Dickens' A Christmas Carol, Tuesday, December 21st at 7:30 p.m. The Farmington Civic Center, 200 West Arrington in downtown Farmington. Find out more online at fmtn.org/shows or 505-599-1148.
Did you know the San Juan County Board of Realtors currently has 211 active realtor members? Working with a trusted and knowledgeable realtor not only saves home buyers time, but also helps take the stress out of the process. A local realtor is ready to help start the home buying process. Find out more at sanjuancountyboardofrealtors.com. The site lists all local realtor members.